Hi everyone, my name is Madeline and I am a super mentor here on AMP Honors Program. And as you can see with this new white coat we're sporting today, I just began medical school. I just started the third week and we got these white coats about a week and a half ago. So it is super rewarding and such an honor to be wearing this and sporting this pretty sporty jacket here. Medical school has been amazing so far. I'm, as you can see, at the University of Wisconsin School of Medicine and Public Health, and the experience so far has been nerve-wracking, exciting, a whole mix of a ton of emotions, but I know that I am in the right place, and I just wanted to share a little bit of my journey so far in these first 3 weeks that I've had. So with that, I wanted to share just about some of the things that I think have helped me adjust to these 3 weeks that I've had. The first of being patient contact. So in our curriculum right now, we have 2 days per week of clinical skills, which is where we basically are in a simulated setting, learning how to take a patient history and ask the right kinds of questions, and in a very personable and conversational and open-ended way, letting the patient also contribute to the interview. You know, it's not just led by the physician or medical student, but patient-centered interviews also allow the patient to contribute just as much as, if not more than, what the physician or provider is doing. So in undergrad, I had a decent amount of practice in talking with patients, both in work experience and in shadowing and volunteering experiences. And I can tell that this experience, just in general, with knowing how to talk to people, and also in learning how to take a history, a patient intake and a history, I did that on some of my medical mission trips, and knowing the right questions to ask, just feeling comfortable with asking those questions. All of that practice has paid off because I can tell that I'm very comfortable in speaking with these standardized patients so far. So if you're able to get out and have those experiences where you can, just practice taking a patient history, talking to people, or even observing that happen, that is something that you could do now that would be a great setup for starting medical school and other professional programs. The other thing that I would also recommend doing that I've kind of noticed has paid off for me so far is taking some sort of public health related class in your undergrad, whether that be something with infectious disease, anything like that talks about public health measures and epidemiology, which in layman's terms, epidemiology is the study of disease and how that is distributed in society. So like disease incidence, prevalence, relative risk factors, all of that kind of stuff. And also learning more about social determinants of health and how there's so many factors that play into a person's health outside of the clinic, whether that be exercise, diet, drug use, like all of those lifestyle factors, living situations, support system, access to care, health insurance, transportation, the list goes on. So health is an all-encompassing term and is affected by a lot of things, and I am glad that I had a little bit of background on what those social determinants of health are, and how they impact health, and also disease incidence and prevalence, just because we've talked a lot about public health. It is a school of public health as well, University of Wisconsin is, and so I'm really glad that we have that curriculum included, just because overall I think it gives a much bigger picture into how providers and physicians can have a greater impact on not only the individual one-on-one interactions that they have with their patients, but also on the community that they're working in and population health. So like I said, it's been amazing so far, and if you have any questions about how medical school has started off, please comment and ask away. And hasn't really been any negatives so far outside of the fact that our lectures are online, which, it just makes it harder to get out and meet your classmates and faculty in person. But otherwise, it's been great, and I am very thankful to be here and very humbled. So I hope I represent and wear this white coat well and continue to do a good job and have a good impact on patients' lives and my classmates and faculty and community. So thanks for watching, and let me know what you think.